we're going to discuss ADHD, Attention Deficit Hyperactive Disorder. What is ADHD? ADHD is a common behavioral disorder. Kids with ADHD act without thinking, are hyperactive, and have trouble focusing. They may understand what's expected of them, but have trouble following through because they can't sit still, pay attention, or attend to details. It impairs a child's ability to function socially, academically, and at home. How does one identify ADHD? Children with ADHD often fail to give close attention to detail or make careless mistakes in school, work, or other activities. They have difficulty sustaining attention in tasks or play activities. They often do not seem to listen when spoken to directly. They do not follow through on instructions and fail to finish schoolwork, chores, or duties in the workplace. And they have difficulty organizing tasks and activities. Continuing, children with ADHD often fidget with hands or feet or squirm in their seat. They leave their seat in the classroom or in other situations in which remaining seated is expected. They run about or climb excessively in situations in which it is inappropriate. They are on the go or often act as if they are driven by a motor. They talk excessively. They blurt out answers before questions have been completed. They have difficulty awaiting their turn, and they interrupt or intrude on others. How to deal with ADHD. The two main ways that ADHD is dealt with is through medication and behavioral therapy, which may be used to treat ADHD which attempts to change behavior patterns. For example, to create a routine, avoid distractions, limit choices, use goals and rewards, and discipline effectively. ADHD in the classroom. The most effective way to treat a student with ADHD is to reduce seating distractions, use a homework folder for parent-teacher communications, break down assignments, give positive reinforcement, teach good study skills, supervise, be sensitive to self-esteem issues, and involve a school counselor or psychologist. Medications. The four main medications for ADHD are Adderall, Concerta, Ritalin, and Strattata. The side effects for Adderall are a student becomes restless, they have anxiety or they're nervous, they have headaches or become dizzy, they have insomnia, they have dryness of the mouth or an unpleasant taste in the mouth, diarrhea, or constipation. The side effects for Concerta are students can have headaches, stomach pains, sleeplessness, and decreased appetite. The side effects for Ritalin are a student can be nervous or have anxiety, they can have insomnia, they have decreased appetite, headaches, or stomach aches. And the side effects for Strattata are a student can have an upset stomach, a decreased appetite, nausea or vomiting, dizziness, tiredness, decrease in appetite, some weight loss, and mood swings. A classroom scenario. If a student with ADHD was constantly fidgeting with their pencil case, pencil, sharpener, markers, or a ruler, then the teacher should remove all objects from the desktop to avoid any distractions. Some facts about ADHD. Boys are about 3 times more likely than girls to be diagnosed with it, and it affects an estimated 8 to 10% of school-age children. In conclusion, ADHD has become a common behavioral disorder, but with the appropriate treatment, a student can excel in the classroom. Below are the references that I used to create my PowerPoint. Thank you very much for listening.